My name is Louise Makau-Barasa, and I currently work as a Senior Director of Programs at the End Fund, a philanthropic advisory firm based in New York and solely focused on the elimination of neglected tropical diseases. This is Sylvia, a 39-year-old female living in Ambaja district in northern Madagascar. Ambaja sits on the banks of the San Marino River, which serves as a source of livelihood for farmers. Sylvia, like many women in our community, works as a rice farmer in the paddies surrounding her village. She raises her son alone after her husband deserted her while she was infected with female genital schistosomiasis. When my colleagues visited her community in September of 2024, Sylvia shared her experience of living with FGS. I felt like my womb was going out, she said, about the pain, anxiety, and distress caused by the absence of an accurate diagnosis when the symptoms first appeared. Sylvia was convinced that she had cancer, but her husband was convinced that she had contracted a sexually transmitted disease by having an affair with another man. He left her, and the feeling of abandonment was compounded by the judgment and regard in which she was held by members of her community. They all thought it was my fault if I was hurting. I felt so lonely. My husband left and he never came back. Nobody supported me, she said. After months of hardship, doctors from Antananarivo visited Sylvia's community and she was able to get treatment. Once I found out the diagnosis, I was so happy because I was going to get the treatment I needed. Despite being cured, Sylvia was reinfected, and she knows she gets it from the infested waters that she works in. Despite this, she says she must work to sustain her family, and so she returns to the rice fields, oscillating between resignation and hope. Women like Sylvia remind us that we have work to do to eliminate diseases such as female genital schistosomiasis, a condition that occurs due to infection with schistosomiasis, one of the 20 neglected tropical diseases affecting over 260 million people worldwide. 90% of those affected live in Africa and need treatment. Female genital schistosomiasis, FGS, as we call it, is a gynecological disease that affects the genital and urinary tracts of women and girls. At least 56 million of them are affected globally. Untreated FGS may present with genital lesions, discharge, and nodules in the vulva. It increases the risk of HIV, infertility, and causes stigma in the community. Clinical diagnosis and treatment are viable with medicines such as praziquantel, and it leads to cure. Despite this, FGS is the risk of reinfection by FGS remains high for women living in areas with high schistosomiasis cases. During my leadership journey, I decided to focus on aspects of the focus on women's health through one of the programs that we support in Madagascar on female genital schistosomiasis. I selected three main components to focus on. One of them was supporting women's health by continue to advocate for funding for this FGS project. The second was to increase visibility on FGS and the need to include FGS in schistosomiasis control and prevention initiatives. And this was by capturing stories through photography and videography that was conducted by my colleagues, and in collaboration with the Ministry of Health in Madagascar and research institution in Canada and Madagascar. And the third was the opportunity to promote women's leadership, to use their voices to advocate for issues that affect them most. And this is through the development of the documentary stories, but also leading a policy brief that then will be considered for inclusion in Madagascar's schistosomiasis control activities. As a result of this work, I focused on the importance of establishing and nurturing relationships with a wide range of stakeholders. These are critical to influencing actions to address public health issues such as FDS that are not often at the forefront of mainstream discussions. This also includes seeking collaborations and leveraging opportunities with other programs such as those focusing on sexual and reproductive health of women in these countries. Ongoing discussions with the FGS integration group and in other countries are indicating opportunities where FGS can be included as part of programming for sexual and reproductive health programs. And so I'm excited to see how this develops in other countries. And then the other thing that I focused on was the opportunity to create activities that develop others and expose them to our work in the field. This included supporting my direct reports and other colleagues during the assignment of collecting the stories and engaging the Ministry of Health in Madagascar during the September trip. And then lastly was the opportunity to take an uncharted path and explore avenues beyond my comfort zone. This included developing and sharing a vision that will bring others along and produce a product whose impact would outlive my tenure in this role and continue to have a life-changing effect on the populations living with or at risk of female genital schistosomiasis. And so I revert looking at the impact of these leadership decisions on the lives of women affected by FGS, such as Yolandri, the epitome of quiet strength and resilience. Yolandri works as a cocoa collector with her husband. Behind their warm smile, one can feel the grinding efforts that were put into building their lives as a family and a business in Abaja. Yolandri was diagnosed and treated for FGS in 2019. The pain and discharges caused by the disease were heavy to endure, but all that now seems to be a distant memory to her. Prior to getting FGS, Yolandri and her husband had two children, now aged 14 and 19. After her treatment in 2019, she was able to conceive and had two more children. She says, "Without the help of Dr. Border, I would not have had my two younger ones. It is a gift," as she looks proudly at them, a clear ultimate reward for her battle with FGS. This work is made possible through the collaboration with a wide variety of colleagues. In Madagascar, colleagues at the Ministry of Public Health, the Bruyere Research Institute in Canada, researchers also at the Association Colavanona in Madagascar, a team of local photographers and translators that capture the stories and faces of these courageous women living with genital schistosomiasis, and the investors that believe in our work and support us through the End Fund. And so I thank you for your time and for engaging with me on this important issue.